The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Don't let your fear of the dentist get in the way of you having a beautiful smile. Sedation Dentistry, hot topic. With us, we have, actually, it's my dentist, Dr. Huenergardt. Dr. Huenergardt, welcome to the program.
Thank you very much. Thanks for having me.
I always say, this program is not an endorsement for the doctor I'm interviewing, because these are real interviews, right? There's no scripts or anything like that. But this is an endorsement. You're my dentist, and but I think I'm an easy one, right? My teeth are pretty good.
Yeah. Okay. Yeah. I feel honored to have you because here you are interviewing all these dentists, and then you come see me.
That's true. That. I could go to any dentist.
I'm very proud of that fact.
I went to you. But the so sedation dentistry. I'm not one of those that really has a fear of the dentist, but I went to your office, and they offered this nitrous. Is that right, the mask?
Right.
And you offer that as part of the program.
Right. Any dentistry, they can have nitrous.
Literally better than a day at the spa. Seriously. Did people ever say that? I'm watching CNN, and I don't really watch the bad news all the time. And I'm there, and I'm thinking about life, and I'm thinking about business. And the nitrous wears off like 2 minutes later?
It's about 5 minutes. We don't recommend you drive for about 15 minutes later.
Yeah, okay.
On straight oxygen, and it just kind of clears out the euphoria.
Makes it a lot easier. I thought, when they told me it was over, I was almost kind of bummed out.
Yeah. Don't turn it off.
It was an hour. So let's talk, for people that don't know you, we've had you in the program in the past talking about dental implants.
Correct.
Today we're talking about sedation dentistry, okay? But tell us a little bit about your practice for people that don't know you. Who's a typical patient? What do you do there?
Well, we treat all ranges of patients from 3 years old all the way up to 101, I think is our oldest patient right now.
Really? Okay.
And so we have a very caring practice, very gentle dentistry is our main concern, and very high quality. So I like to do dentistry that lasts. So we're real big on that.
You have a lab there too. You make things.
Right. We do make crowns on site and with the CERAC machine, and it's computerized dentistry, and I can. That's
like a $100,000 machine or something like that?
Yeah.
So it makes the crowns right there? Right there. Do other dentists use your lab?
No. Just me. I keep my machine pretty busy.
Kind of selfish with that CERAC machine? So when you hear these ads, or teeth in a day, is that an exaggeration? Could somebody go in and you can make a crown right then and there?
That's correct.
How long does it take?
It usually takes about 5 minutes to mill the crown, and to do the very strong ones, we actually fire it, and it takes about 15 more minutes. So
you have a high-tech office too.
Very high-tech.
Probably one of the most advanced in our
area, I guess.
Is that right? And where are you located, by the way?
In Oceanside.
You have people that come in from San Diego.
Yeah.
Is that right?
My last interview with you, I've got people from El Cajon, San Ysidro, coming all the way up here. So it's
you're like a local celebrity now.
Yeah, people say that.
Do they like you? What do they say? What do they say?
They say, I think that Randy really likes you. It's kind of funny.
Okay, so your practice, you also make dentures?
We do dentures. We do partials. We do implants, dental implants. A big part of the sedation.
You're one of the kings of dental implants, I say to people.
We do a lot. We do a lot of implants, and we're helping a lot of people is what I'm proud of the fact, because these people have lost something and we've been able to give it back to them and restore their confidence and their smile, and they don't have to hang their head anymore. They have a nice smile that they can enjoy and chew with.
Now, by the way, how long have you been a dentist?
I've been a dentist for 25 years now.
25 years? You love it, don't you?
I love it, yeah. I think I was born to be a dentist.
Really?
Yeah.
When did you know you were going to be a dentist?
Handpiece in my hand or something.
When did you know you were going to be a dentist?
About age 10.
You're kidding me.
I love my dentist, and I don't know why.
That's very strange.
He was great, and he had a nice lifestyle, and I thought, I wanted to be like him. And I didn't really know why until I got into it. I went through dental hygiene first. I graduated in 1982 in dental hygiene.
Oh, really?
So I wanted to make sure.
Oh, you were a hygienist first?
I was a dental hygienist first.
A male hygienist?
Only male in the class of 35 women. It was really tough.
With that hygienist training, you probably could do things that regular dentists don't do or aren't used to doing.
I think they can still do it. I think it's just our emphasis has changed, and I realize that.
They do a lot of the work, these hygienists.
Right.
I think almost all the work, it seems like sometimes.
And it's the quality of removing the deposits that gets the results.
You're also a patient, right? Can we start with your photo? Because you brought your photo. I think it's a nice little touch here.
This is me before. I had actually sedation dentistry myself.
Okay, let me take a look at this. Now, you didn't like your smile. Well, I mean, when I look at your smile, it seems like a very friendly smile. What's wrong with it in this photo?
In that picture,
when you look at it, what's going on?
My teeth weren't showing. My smile, I have a very low lip line. Some people have a high lip line and they show all their gums when they smile. Other people have a lower lip line, and so my teeth wouldn't show. And so I never liked my pictures. You know, I looked prematurely aged.
All right.
And the technical term for it is mid-face collapse, and it happens to all of us to a certain extent. But to me, it had happened at an earlier age.
So what did you have done?
Through clenching. I think I was clenching. I had I opened my bite up, so I did all my upper teeth with veneers.
Okay.
I had a dentist do that, and we made my central incisors were 8 millimeters long, and now they're 13 millimeters long. So I have long teeth, but you can't see that.
Let me see you smile right now. There we go. That's a nice one. Let's take a look at that after.
So here's a picture I can be proud of.
Nice.
So it made a big change in my life. Now I'm proud of my pictures.
I mean, it's nice to see a dentist that has great teeth. Now, one of the things too, and by the way, you taught me this stuff, that the front two teeth are a little bit longer.
Right.
When we look at that.
I try to avoid the straight across, because that looks like a denture. When our teeth wear,
like mine are straight across. But they're not veneers. But they're not veneers.
Right.
I'm stuck with these things.
But they're not straight across though.
Oh, they're not?
Because they follow your lip line.
Okay. You know, and by the way, I should mention, ever since I had my procedure done with you, okay, and had nitrous, it was literally a relaxing experience, okay. And I've told all my friends about this, but I've talked to dentists since, you know, because my show airs all over the United States and in Canada. And I'm surprised at how many doctors don't do that. They say, well, we don't need it, or our patients don't need it. And I can't help but think that that's almost like a little insensitive to not offer that to your patients. I mean, what are your thoughts on that?
I think we did not know how many people are actually that frightened until oral sedation came into vogue it was about 10 years ago maybe. I've been doing it for 8, and people just come out of the woodwork to find you. They find out that you do sedation. We didn't realize that it's almost 20 to 30% of the population is very fearful of the dentist.
So it's like a luxury, though. I mean, if you're not afraid of the dentist, it's a luxury to go to a dentist that does sedation, because it's a relaxing
experience, and a lot more TLC.
It really is.
Because the office understands people's fears and anxieties, and just going and get a teeth cleaning is hard for some people.
Let's talk about the highly anxious patient, because it's hard to believe for me, but there are people that are really, really afraid of the dentist.
Yes, extremely.
And hate their smiles and do nothing about it.
There's people that will drive by your office 5 times and not come in, and finally that 6th time they'll come in. Yes, they're very, very fearful, and they've had a bad experience, and it's written in their memory. And once it's etched in your memory, especially if it happens between ages, I'd say 6 to 14, they have a bad experience, and they just constantly go to that post-traumatic stress syndrome situation. So it's very traumatic for them to come, and we specialize in overcoming that fear. And
I mean, do you see turnarounds? I mean, those people you say that drove by your office, do you see turnarounds?
Oh, amazing, amazing. People that wouldn't step foot, where my receptionist, Jennifer, has to go out and grab their hand at their car and bring them in and say, it's okay, he's not going to hurt you, he's very understanding. And they come in and they talk to me, and you know, we make sure that first visit is very important, because there's a period of bonding there and some trust building going on. And when they sit down and talk about their fears, and they confide in you, and you don't hurt them, and you just look in their mouth. We don't even take x-rays sometimes. We just look and kind of give an overall view of what needs to be done, and then they can come back and get the x-rays and everything and find out what the finances are about. But it's usually a very positive experience. Sometimes there's even tears. Sometimes I cry.
Really?
Because, yeah, you just ask them about their fears, and they start explaining, and you're to the point of like, this is pretty intense, you know, and it's more of an emotional experience for them.
To say that I was terrified of the dentist would be an understatement. I had an absolute phobia of the dentist. It was debilitating. I hadn't gone for 10 years. My teeth were horrid. And luckily I found Dr. Huenergardt, and they did sedation work, and it's like total amnesia. You don't remember anything when you come out. So no trauma at all, and I don't sweat and have anxiety attacks when I walk in now, because It was so painless. I had 16 crowns done and 3 root canals, and my bottom teeth are now straighter because of all the crowns he was able to straighten up, and I didn't need braces again. So my life's changed dramatically because I'm not afraid to smile anymore. There's so many people like me that have a terrible fear of the dentist, and don't let your fear stop you from having a great smile. It's the best thing I've ever done.
I have been afraid to go to the dentist for 20 years. My teeth were yellow and ugly, and I hid them whenever possible. I hated to have pictures taken. And finally my eye tooth shattered, and I had no choice but to find a dentist. And I went to Dr. Huenergardt, and the difference is amazing. He did a lot of work under sedation. I came in. When I left, I was just happy. And he's since done other work where I didn't even need sedation because I'm no longer afraid. People compliment me on my smile all the time. They really notice the difference because the difference is really noticeable. If you have a fear of the dentist, go see Dr. Huenergardt. I can't tell you, for 20 years I was so afraid, and one visit with him, and I go every 3 months to have my teeth cleaned. I recommend him to my friends, and I recommend him to all of you out there. Call Dr. Huenergardt. You won't be sorry.
I have 2 crowns, and I also have all of my fillings removed, and I have porcelain in my teeth now. It always makes me feel terrific when people take a look at me and say, wow, your teeth look terrific. Who's your dentist? And I get a chance to tell them that Dr. Huenergardt is the one that takes care of my teeth. Well, I'm not afraid at all to see the dentist. In fact, I go in for 2 cleanings a year. The first time I walked in Dr. Huenergardt's office, I was so nervous. I had not been to the dentist in over 10 years. My hands were wet, I was shaking. I had to bring my husband with me. He sat through the entire appointment with me. Dr. Huenergardt had 2 dental hygienists, one that was so sweet that she actually held my hand through the entire visit, and another hygienist just to assist him. And now I go and I don't have any nervousness, no tension whatsoever.
I mean, you have training to do very complex cases. I guess it's called full mouth reconstruction.
Full mouth reconstruction.
Is that usually the sedation patient, the person that hasn't been to the dentist in 15, 20 years?
Very often, not always. I mean, we have people that come in and just need a few fillings, and they still want to be sedated for it. I mean, it would be something that might be easy for you and I, but it's difficult for them. So it can be very small, it can be very large. The person that hasn't been to the dentist for 20 years, it tends to be more.
How common is that, by the way? People that haven't been to the dentist in 10 years, 15 years, 20 years?
It's fairly common, you know.
Okay.
Like I said, you know,
I mean, we're hoping with a program like this.
It might be 10–15%.
Oh, really? Okay, so with a program like this, there's people out there. What do you say to them? They're watching this. They haven't been to the dentist in 15 years. Because you say it's a lot less expensive. The longer they wait, it becomes more expensive, the dentistry.
Correct. So the sooner we get in there, the less damage has been done. You wait 20 years, then more damage can happen. So then more treatment needs to be done, and of course there's costs that are involved there.
Okay, and then there's another crowd, you say like the busy people, the CEO or the business person that has a lot of work that needs to be done, and they don't have the time, or at least they say they don't have the time to go to the dentist.
Correct. And we get these gentlemen in there that just they don't have time to come in, and they're busy CEOs or you know presidents of companies, and they have a busy schedule, and they tend to be grinders, a little bit harder on their teeth because they're intense individuals, and they've worn their teeth down quite a bit, and they need a smile makeover. They need to get that pop back in their smile, and we can just sedate them and do it in one visit.
You can do 6 hours worth of procedures. What may take normally 3, 4, 5 trips to the dentist.
That's
like what?
True.
I mean, what do you
That's
do
true.
in 6 hours?
We can do a root canal, a post, and a crown.
Like an example. Give me an example.
Where we'd have to refer somebody out to a specialist in traditional practice, where I can do the whole procedure in one visit.
So maybe a root canal,
and then the post and the crown all in one visit. They walk out with a permanent crown instead of having to go to the endodontist, the dental specialist, root canal specialist, and then.
So you do root canals?
Yes, we do.
Is that right? So if they go to some dentist, they may have to, like, especially if you're afraid of the dentist, last thing you want to do is go to 2, 3 dentists.
Correct.
So you had extra, what, it's called endodontic training to do root canals?
Well, we get that in dental school. Then you can take continuing education classes to enhance your abilities.
So you might do dental implants, crowns. What about whitening? I mean, everything all in one day?
Whitening, everything.
Do you get tired, by the way?
On a long 6-hour procedure, you do, but you have to take care of your protein needs and eat well.
Should you bring like a little shake or something?
And exercise well and stay healthy to do these. because they are physically and mentally.
Do you like them? Do you like them? I mean,
I love them
gives you a
because
charge?
you change so many people's lives, and you just become. That relationship is just such a great relationship that you develop.
Do you have a lot of patients that have been coming to you for 25 years that you've been doing this?
Yes.
Really?
And they're my best missionaries. They send me lots of patients. And
okay, good. Now you brought photos because you said, Randy, I want to show you how sedation dentistry can change people's lives. So what do you got?
So here's an individual, and she came to my practice. She's in her mid-30s, and she's very, very frightened of the dentist. She's worn her teeth down, as you can see here, and she has a lot of decay in her front teeth.
Okay.
And when she smiles, her teeth do not show, and they're very darkened. And so what we did was we explained everything, procedures to her, and that she was going to be sedated during. And we actually showed her a...
Was she ashamed of her smile, by the way?
Very ashamed. She would hold her hands in front
Even
of her
on
face.
the consult?
Even on the consult. It's hard to get this picture because we could get her to smile. You know, we had to joke around with her a little bit to get the full smile.
Okay.
There, and that's as much as she
You
would
had to
do.
use the Dr. Huenergardt charm that you're
Right,
known
correct,
for in
correct.
San Diego.
Yeah.
Okay, okay. And so what was it? So her treatment plan was what?
Her treatment plan was we did her full we treatment planned her full upper arch for crowns.
Okay.
Because every tooth had decay, or some of them needed root canals, and other were just worn out with large fillings in them.
So sedation, oral sedation, or the
oral sedation.
All right.
And we also want to change the dimension in her bite. We want to give her, instead of so much of a round face, more of an oval face.
All right.
And you
all
can
right.
do that. And as you saw in my pictures, it changed my appearance.
Yeah, you went from like,
I look like I lost
Jackie
weight.
Gleason to this handsome guy on the actor.
Yeah.
Okay.
So that's what we want to do for her.
All right.
And if we're going to do a full arch of crowns, like the full upper arch, of course, we can change the height of every tooth and change that dimension between your nose and chin. So here's the after shot.
Very nice.
So, as you can see, it changed the round face to a more oval face. It gave her the confidence to smile. She can chew better. She actually went out and got a different job and improved her career.
Did they tell you all this stuff?
Yeah, they tell you all the things that how it changed their life, because they were so ashamed before. And like I said, she held her hand over her face when she smiled, or
So
she wouldn't smile.
So a lot of anxiety. Oh, now, when you see them on the follow-up, so they're less and less afraid every time, obviously.
Correct. They come in and they're not afraid to let you look in their mouth, get their teeth cleaned, and sometimes we just wean them down too. Sometimes they go from the oral sedation, and next time they're using the nitrous oxide.
The nitrous.
Right.
That's the mask.
Right.
That's
So
my favorite
every time
stuff.
less and less, unless they really need it. Then we still. There's some people that just never drop that fear.
When I went to your, I made an office. I made an appointment for a teeth cleaning at your office, right? But it was, they go, well, we're busy. I go, could you just fit me in? So they fit me in, but then they had to cancel. I was bummed out because I was thinking of this relaxing experience again at your office. We've rescheduled, but no, I mean, it's no kidding. And I'm not trying to push this, but to me, I think, look for a dentist that offers sedation. I'm not afraid of the dentist, but it's really relaxing.
The health benefits, because gum disease causes clogging of arteries.
Yeah, and diabetes and everything else. It
everything.
causes inflammation.
Correct.
And you do that both with lasers, and your hygienist get in there and clean under the gum line.
Correct.
Is that right?
We do that. And I also, if there's a sedation patient, I either have the hygienist come in or I do it. Since I have the hygiene training, so now we're doing multiple procedures at once. We're doing, full mouth crowns, scaling and cleaning, and root canals, implants, whatever they need. It's kind of a one-stop, one-visit procedure.
Do you do pretty much everything there?
Yes, we do.
And after dental school, I mean, you've had a lot of training
A lot
after
of
dental
extra
school?
training. Dental implants, oral sedation. I have an associate that does IV sedation, so we can do IVs, which is a deeper level than the oral sedation. We have a general anesthesiologist that comes in for full hospital. I mean, some people don't want even the IV or the pill. They just want to be out. And so he can come in and do it. You don't even know that you got the injection, because they put the gas on and you're asleep before he puts the needle in.
Now, I've heard that people sometimes, they can't even sleep the night before. They're so anxious about the dentist, and that you guys have to prescribe maybe a medication the night before. Has that ever happened to you?
Sometimes too, like when I was a little bit nervous, because I have 14 virgin teeth that were going to be prepared, so I was concerned. And I didn't sleep very well that night, but that was an advantage because when I went into the office...
And you're a dentist and you were still worried about it.
You know, it was 14 teeth that were in perfect condition, and I did it because I wanted to change my smile.
And this is your after. Looks very nice. Very nice.
So,
very nice.
I would never look back. I'm glad I did it. And I wish I would have done it sooner. Like, I've been thinking about it for 7 years, and I actually tried in some what they call snap-in teeth to see what it would look like. And my wife said, well, you're going to put in your snap-in teeth tonight. And I go, uh-oh, that means I'm going to have to do this. So I went and had it done, and I had the treatment, and I never looked back. I'm happy about my smile and my appearance, and it's something that I'm glad I did.
Yeah, that's good, because you would have been known as the dentist with snap-in teeth all over San Diego.
Right.
All right. Okay, so Sedation Dentistry, if you're just tuning in, Dr. Huenergardt says, don't let your fear of the dentist keep you from having the smile you always wanted, right? Okay, so what other photos are we looking at?
This is a very extreme case here, and this gentleman, about 50 years of age, and
oh my goodness.
He's probably one of my most difficult cases. His jaw was angled at an awkward angle, and I figured if I could restore his mouth and make it look this good, then I could do that for anybody. He wouldn't even let his teeth show, and he had a lot of difficulty chewing because his bite had closed down so far. So we were to open up his bite quite a bit and give him a full set of teeth. In one visit, we did his full mouth, placed 4 implants in, extracted a couple teeth, did a couple root canals, and he left with full temporaries in his mouth and a nice smile. Because the way we do this is we design the smile in a wax form. It's like an architect would do a model for somebody's house, build the house in a small scale first.
Okay.
We do that with the models, we do that in a wax up form. Then we duplicate that into the patient's mouth, and they get to see what their teeth look like before they're completed.
It's nice.
And make sure that
So this guy, though, because he looks like a tough guy. I mean, this is a guy that was actually afraid of the dentist?
Very, very fearful. It doesn't matter how tough you are. I mean, probably the guys in prison are probably some of the most scared of the dentist.
Okay.
You know, it's like the guy with tattoos all up and down their arms can be very scared of the dentist, but they're not scared of the tattoo.
Yeah,
guy, you know?
yeah. So this guy comes in, I mean, do you recall, was it oral sedation?
Oral
nitrous?
sedation.
Okay.
And we sedated him. It was about 5 hours to do everything.
Is that right?
And he walked out with new temporaries and his new smile. And then we used that period, that 2-week period while the teeth were being made, to confirm, you know, how he liked his smile and how the bite felt. Something that you can't do in doing it all in one day. You get a trial run with your teeth if you could do it in 2.
And I should mention, by the way, because you have things at your office that most dentists across America don't have. Like that CEREC machine where you make the crowns in one day. Normally that's sent out, patient has to make a couple of trips, and because of sedation, and correct me if I'm wrong, because I want to make sure we stay on message here, that because of sedation allows you to do what may take 3 to 5 or 3 office visits, you do it in one day. And because of your CEREC machine.
Right, CEREC. So,
right?
you know, typically a 4-hour visit, we can do 5 to 6 crowns, maybe a couple root canals, a deep scaling, and that's about it. Maybe a few fillings in there. You know, there's a maximum you can do in one visit.
And you teach other dentists, right? I heard you had at your class reunion, your dental class reunion, you spoke about dentistry.
Right. I had a lecture about some of these large cases we do, about sedation, about dental implants, and about how to
incorporate. You're so into it, they had to
surgery.
pull you off stage, I heard.
Yeah, I was supposed to be. I thought I had enough material for 45 minutes. It ended up being almost 2 hours. So
we're going to have to really rush if you want to get any more photos in. So what are we looking at there?
This patient here, she had an upper denture. You can see the teeth had fallen out, been re-glued in. Just extreme fear, very, very much with high gag reflex. I find that a large percentage of the fearful people have gag reflexes.
Yeah.
And that, you know, the way dentists react when we're working on people with gag reflexes, we kind of raise our voice. You know, breathe through your nose, breathe through your nose. You know, point your toes, and it ends up being a very intense visit every time they go. And so.
But not in your office.
Not in my office. So
you don't raise your voice or tell them to point
every
their
visit
toes.
she's ever had in her whole life has been intimidating and difficult, and they leave in tears.
Really?
Because they feel bad for the dentist that they have so much trouble because they gag so easily. And so for her, she just wasn't ever going back. And her trigger points were all in her lower jaw, because she has an upper denture. You'd think that'd make her gag, but it was all
So
in her lower
what?
jaw.
So a little bit of nitrous or oral sedation, and
She had a full-on general anesthesiologist, because her gag
Wow.
reflex was so intense. And so we were able to, she was losing her lower teeth. She had 6 remaining, and she was chewing with that against that upper denture. That's why she was breaking all those teeth out of her denture, because 6 teeth were hitting the upper.
So this is a person like deathly afraid of the dentist.
Extremely. And so we made her smile. She left with permanently cemented teeth and walked out the door with.
Let's take a look at that. Let's take a look at that after.
It's amazing.
That doesn't even look like her. That's probably your best photo I've seen.
That's one of the best.
I mean, she looks. I mean, you can't help but judge a person like that on the before, and the after. And now she's got dental implants. Interesting.
And it changed her life, you know. And she come back, and she's one of my best missionary. She sends me lots of patients, and
Is she? And she's no longer afraid nowadays.
she can get her implants clean. That's all she has to have cleaned is her implants.
But I mean, when
It's
she
very
goes
easy.
there, she's not afraid at all.
She's not afraid at all.
It's like when you go to get your hair cut, you're not afraid. When you go to Dr. Huenergardt's office, you're not afraid at all.
No, and it's just it's so rewarding, and we just. It's like I said, it almost brings you to tears, because you're doing that much help for somebody and changing their lives. You just don't get to do that in every profession. And that's why I feel very blessed to be a dentist, because I can help these people change their lives and get them past what's been holding them back from living life, from enjoying their food, from smiling with their friends, from looking at their photographs like me. You know, I mean, that just, you know, I get teary-eyed just talking about it.
I love it. Well, good for you. We're out of time. But okay, so sedation dentistry for the person that's busy and wants to do everything in one day, and for people that haven't been to the dentist in 20 years, you're not going to guilt trip them over there.
There's
right?
I believe in dentistry without guilt. That's one of my mottos.
Is that right?
Dentistry without guilt. We have other guilt placing persons in our lives. We don't need the dentist to do it.
Good for you.
It doesn't win friends. It just causes anger and embarrassment. So we don't go there.
Okay, good.
So we're very understanding.
Well, good for you. Well, I want to thank you for coming on the show.
Okay,
Good
well,
stuff. Good stuff.
Thanks for having me, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. You can put in Dr. Huenergardt's name, which is very tough to spell, so you can just put in Sedation Dentistry or Sedation San Diego. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.